everybody. Thank you for coming today. You're all here because you would like to volunteer at local nursing homes. So today we have just an informational presentation about dementia. When you work in the nursing homes, you will more than likely will be working with patients who have dementia. So this is just a short little presentation about what is dementia, what are some signs and symptoms, and help you to be able to work with those patients that you have in the nursing homes. All right, so dementia, what is it? It is a degenerative disorder, which means that it does progressively get worse with time. And as of now, there is no cure. There are only treatments to help alleviate some of the symptoms that are seen with dementia. The definition is that it's a group of symptoms affecting memory, cognition, and social abilities that affect daily activities. Now, when we think of the aging process, we think of a lot of those memory problems and cognitive problems as just a typical thing of aging. But there is a line when it crosses over into dementia. And later on, we're going to talk about some of those symptoms and how to be able to tell whether or not it is dementia or if it is just natural aging. Okay, so first, what are the etiologies or what are the causes of dementia? So there are three different types. You have cortical, subcortical, and mixed. So cortical is degeneration of the cerebral cortex. And there are three different types of dementia that you see under this cortical category. You have Alzheimer's, frontotemporal dementia, and Pick's disease. And then you have subcortical, which is degeneration of the subcortical structures. And in this one, you see Huntington's disease. And then the mixed is degeneration of both the cortical and subcortical parts of the brain. And in this one, you see vascular dementia, Lewy body's disease, and Parkinson's disease. Okay, so the epidemiology, here are just some facts about dementia. You have the Latin America has the highest prevalence of dementia. In the early 2000s, 18 to 25 million people worldwide were affected with dementia, and this is thought to double by the year 2020. So by 2020, it is thought that there will be 36 to 50 million people affected worldwide with dementia. And then only 2% of those affected with a type of dementia are affected under the age of 65. So you can see an early onset that happens before the age of 65, but it is more common to see it start occurring at or after the age of 65. Okay, so some risk factors that could increase your risk for having dementia later on. A big one is family history. Some types of dementia can be genetic. They have a genetic component. So if you have a family history of a type of dementia, you are more likely to have that later on in life. Females are more likely than males to get dementia later on. Hypertension, smoking, heart disease, these are all factors. And then lower SES or lower socioeconomic status, that is also a risk factor for having dementia. And a big reason for that is lack of access to healthcare and lack of education about this disease, and it could lead to your risk. Okay, so some signs and symptoms. This will be important for you guys. These are some things that you might help patients with some of their challenges. So the first one is memory loss. That is a primary symptom of dementia. Mostly it starts off with short-term memory loss and then long-term later on as the disease progresses. Challenges in planning and problem solving, so maybe they need help planning out their daily activities or maybe need a memory book to help out with that. Getting lost in familiar areas. This can be a big one to help you understand if it's dementia or if it's the natural aging. If they're getting lost in new areas or they have new directions to a place and they're getting lost, that could be just typical aging. It happens pretty commonly to everybody when they're going to a new place, so that could just be typical. But if they're getting lost in familiar areas, like say in their house, or if they walk their dog every day in the same path and they're getting lost on that route, that could be a sign of dementia. Socially inappropriate behaviors that were not presently seen could be a sign. decrease or poor judgment could also be a sign, and then difficulty completing familiar tasks. And this one kind of go along with getting lost in familiar areas. This can be a sign of whether it's typical aging or if it's dementia. If they are doing new activities and they're having issues completing it, that could be just typical aging. But if they say make the coffee every day in the morning and they're having problems completing that task, that could be a sign of dementia. Okay, and then communication deficits. There are some communication deficits that go along with dementia, and these are some things that SLPs help out with. So we have word finding difficulties, comprehension deficits, so they're not understanding what's being said to them or maybe what they're reading. Short-term memory loss, so maybe they can tell you something that happened to them when they were a child, but they can't tell you whether they took their meds that morning or if they had breakfast. Expressive language difficulties, again, it's hard for them to express their wants or needs, or if something happens, it's hard for them to let you know what's going on. And then some types of dementia can lead to mutism, so they could be completely mute. So how to prevent dementia? There are some things that can be done to help prevent dementia or to push back the onset of dementia. And the biggest thing is keeping your brain stimulated with activities. Mental stimulation is a great way to push off dementia. And some ways to do this is reading books, playing board games, especially board games that involve strategy, that really make you think about a way to do things like chess or Clue, things like that. And then also learning a new language or a new skill. That is a great way to keep your brain active and going, especially later on in life. And then eating healthy foods and staying active, all the typical things that doctors tell you to do to stay healthy, those can really help keep your brain active and keep your brain healthy and can help you stay stimulated. And then participating in social activities, so staying active in your community, staying active with friends and family. That's another way to ward off isolation and the onset of dementia. So here we have some resources that would be good resources for you guys to look into to learn more about dementia, or also for you to pass along to the family members of those that you're working with dementia. So the first one we have is the Alzheimer's and Dementia Resource Center. And this is an online resource that you can go to, and it can tell you more about dementia, tell you more about the different types, the different causes. It also has links to research articles. They can tell you about different types of treatment, different types of therapies, and different types of research studies in case families are interested in that, and in case you're interested in learning more about dementia and what goes on with the research side of it. And then another one is the Alzheimer's Caregiver website. This is a good one because caring for those with dementia can be a difficult task, and it's important to take care of yourself as caregivers so that you can give good help to those that you're caring for. So in this one, they have some support groups and chat forums so that you can bounce around ideas for treatments and things that work for other people. And it's a very informal website to talk to other people who are going through similar things, and this would be a good one to pass along to families as well. They also have information on residential facilities and group homes, so this would be another good website to pass along if people are wanting to look at their options and see what all is out there and is available. All right, and that is all I have for today, so thank you guys for sitting and listening to my speech.